Hello, everyone, and welcome to our first discussion of Sequence 1. Chapter 1 deals with the introduction to the dental profession. This starts on page 2 of your big blue Cengage dental assistant textbook. So a few things that we'll be discussing in Chapter 1 is we're going to review dental diseases and dentistry all the way back from the beginning of time. We'll identify the items of the timeline on dental history. We'll name some individuals who had a great impact on the profession of dentistry. We'll identify the people who promoted education and organized dentistry, as well as explaining what DDS and DMD stand for. We'll identify the 9 specialties of dentistry, describe generally the career skills performed by dental assistants, dental hygienists, and laboratory technicians. And lastly, we'll list the education required for and the professional organizations that represent each dental career path. So we'll first start off with some history of dentistry. So back in the early times, we have a couple of very important people. First, we'll start off with Herodotus. This was a Greek historian who acknowledged the specializations of physicians in particular areas of medicine, such as dentistry. The earliest dentist of record was Hesi-Ray of Egypt, who practiced around 3000 BC. Dentistry in the early times consisted of removing teeth when pain occurred, and there was some evidence of drilling holes to relieve an abscessed tooth. During these early times, stones would get mixed in with food, and chewing grit in food would cause severe wear of the biting surfaces of the teeth and possible pulp exposure. The Ope of Hippocrates, written by the father of medicine, Hippocrates, is still used in today's medical and dental professions as a standard of care that all in the profession are expected to uphold. Aristotle helped bring attention to the importance of dental hygiene. Later down the line, a person by the name of Guy de Chauliac wrote hygienic rules for oral hygiene. Many of these rules are still used today because they were based on sound logic, such as sticky sweet foods cause an increase of dental decay. Leonardo da Vinci dissected the human skull and drew illustrations of his findings. These drawings contributed to the dental profession by making the distinction between premolars and molars. Pierre Fauchard has been referred to as the founder of modern dentistry. He was the first to gather all known information about dentistry and organize it in a book with step-by-step pictures for each procedure. He believed that hormonal imbalance caused by caries, which is a term for decay, he believed that hormonal imbalance caused caries, which is his term for decay. He treated teeth by removing caries and by rebuilding the teeth with materials such as lead, tin, and gold. He used dental prostheses and implants to restore teeth and used wires and devices to straighten teeth. William Conrad Röntgen helped dentists further their knowledge of the oral cavity and its diseases by discovering x-rays. So just to recap, who wrote the hygienic rules for oral hygiene? Well, it's right here. That would be Guy de Chauliac. Robert Wolfendale came to the United States from England and began advertising dental services. Shortly after his arrival, John Baker also began advertising about fillings and artificial teeth. John Baker was well known and one of the dentists who treated our first president, George Washington. John Greenwood was a well-respected dental practitioner and a proponent that children should care for their teeth. He made George Washington's final set of dentures. The dentures were made of ivory and gold and had 2 springs holding them together. Paul Revere contributed to dentistry by making artificial teeth and surgical instruments. He may have trained dentists in the late 1700s. The dental chair with an arm extension to hold dental instruments and an adjustable headrest was a major contribution to dentistry by Josiah Flagg. He was a skilled surgeon and performed corrective procedures such as cleft lips, orthodontics, and endodontics. In the 1800s, dental materials improved. Dentists were more educated and new techniques were developed. This is the time that James B. Morrison manufactured the first dental engine with a functioning handpiece, motor, and foot treadle. With the efforts of Horace H. Hayden and Chapin A. Harris, the Baltimore College of Dental Surgery was founded in 1840. It was the first dental college in the world. Both Hayden and Harris contributed to the knowledge and literature of the dental profession. Dr. Samuel D. Harris, whom the museum was named after, was instrumental in founding the museum. It is the largest and most complete museum of dental artifacts and history today. Here we have Dr. Green, Barnum, and Black. Dr. Black, also known as the grand old man of dentistry, continued educational contributions to the dental profession and is credited with the classification system of dental caries, which we still use today. He developed many instruments and machines for use in the dental profession. Lucy Beeman Hobbs was the first woman to graduate from a recognized dental school. Robert Tanner Freeman was the first African-American man to graduate with a dental degree. 11 years later, Ida Gray became the first African-American woman to earn a dental degree. George Franklin Grant also graduated from Harvard Dental School and was an expert on the cleft palate. He may be well known in the golfing community, however, for his invention of the golf tee. Hayden and Harris had strong beliefs in the need for sharing information with the dental profession. They played a big part in founding a national organization for dentists in the United States. Their initial organization evolved into what is now known as the American Dental Association. One of the earliest journals in the field of dentistry was the Journal of the American Dental Association. The ADA today has organizations in each state. Each has a set of ADA-approved bylaws, and the official publication of the ADA is the American Journal of Dental Science. All right, so just a quick check here. What was the name of the first dental college in the world? Well, this is the Baltimore College of Dental Surgery. All right, so now moving on to the dental team and what that consists of. So the dental team includes dentists, dental assistants, dental hygienists, dental laboratory technicians, and support staff. The overall patient experience and the efficiency of the dental office depends on the team and how well they perform their specific skills, roles, and responsibilities. Dentists have 3 to 4 years of undergraduate work and an additional 4 or 5 years of dental school. Dentists may specialize in various areas such as public health, endodontics, oral and maxillofacial pathology, oral and maxillofacial surgery, oral and maxillofacial radiology, orthodontics, pediatrics, periodontics, or prosthodontics. Dental assistants generally have about a year of training and are employed to aid the dentist to care for more patients efficiently and effectively. Dental hygienists receive 2 or 4 year degrees and specialize in providing prophylaxis. Dental laboratory technicians may have 2-year degrees, but often are trained on the job with no formal educational experience. They may or may not work within the dental office. Support staff may consist of service technicians, sales representatives, or administrative assistants. So the requirements of a dentist is that they have an undergraduate education and a graduation from a dental school approved by the ADA Commission on Dental Accreditation. A dentist should expect 2 or more additional years of postgraduate education in an approved specialized training area. Each state has their own regulations the dentist and the dental teams are responsible to follow. In order for a dentist to practice in a specific state, they must first pass a written and clinical exam for that specific state. So dentist education includes 3 to 4 years of undergraduate work and about 4 years of dental school, unless they get their dental training from Harvard University, which requires 5 years of training. So there are 9 specialties recognized by the ADA. Dental specialties in public health is a specialty concerned with prevention of dental disease. Public health dentists work with the community to promote dental health. A dental specialty in endodontics is a specialty concerned with the pathology and morphology of the dental pulp and the surrounding tissues due to injury and disease. And the dental pulp is what a lot of people associate with the nerve of the tooth, which is in the inside or the middle portion of the tooth. So a patient would go to an endodontist for a root canal. Dental specialties that have to do with pathology or oral and maxillofacial pathology. This is a specialty concerned with the diagnosis and nature of diseases that affect the oral cavity. A patient will be referred to an oral pathologist for extensive treatment and diagnosis of a lesion. Radiology has to deal with oral and maxillofacial radiology, and these are images and data produced by all modalities of radiant energy. These are for diagnosing and the management of disorders of the oral and maxillofacial region. Dental specialties involving surgery also have to deal with oral and maxillofacial surgery. This specialty is concerned with the diagnosis and surgical treatment of oral and maxillofacial regions due to injury, disease, and defects. When a patient is having their wisdom teeth pulled, they would most likely be referred to a maxillofacial surgeon. Orthodontics includes orthodontics and dentofacial orthopedics. This is a specialty concerned with the diagnosis, supervision, guidance, and correction of malocclusion and dentofacial structures. Malocclusion is just a fancy word for a traumatic bite or a bite that is not correct. So an orthodontist applies braces for patients who need their teeth straightened or aligned. Pediatrics is a specialty concerned with the prevention of oral diseases and diagnosis and treatment of oral care in children. This is from birth all the way through adolescence. Periodontics is a specialty concerned with diagnosing and treatment of diseases of supporting and surrounding tissues of the teeth. So a periodontist treats patients who have plaque and calculus buildup and have lost some of the bone around the tooth. So the periodontium is the surrounding or supporting tissues of the teeth, such as the gum tissue and the bone in which the teeth are held in place by. Prosthodontics is a specialty concerned with the diagnosis, restoration, and maintenance of oral functions. This area of specialty includes the replacement of missing teeth through artificial means. So somebody would go to a prosthodontist if they needed a new set of dentures, if they needed to have a crown or bridge replaced or fabricated, or if they just needed a partial denture or what we call a flipper in case they're just missing 1 or 2 teeth. All right, here is another dental check. So this is involving dental specialties. If you lost several teeth related to trauma resulting from a car accident, which dental specialist might you seek assistance? Well, this one we just sort of talked about just now, and this would be a prosthodontist. The prosthodontist deals with prosthetics involving the mouth, such as dentures, implants, crowns, bridges, that sort of thing. Okay, so now dealing with dental assistants. So Dr. C. Edmund Kells was the first doctor to hire a lady assistant. And he did so because he wanted somebody that was going to be quick, quiet, gentle, and attentive. So once the public accepted a female working in a dental office, women were then able to go to the dentist without being accompanied by their husbands or a maiden aunt. Today, depending on the state and their Dental Practice Act, the dental assistant performs such duties such as placing retraction cord, and dental dams to extraoral procedures such as patient education. So back in those times, he would actually have a sign out front that said "Ladies in attendance." This would be a sign that the women can then go into the office without being accompanied by their husbands or a maiden aunt. So the dental assistant practice is governed by the Dental Assisting National Board, otherwise known as DANB. If you are certified through DANB, you can become a certified dental assistant or a CDA. There is also an expanded functions dental assistant, a dental receptionist / practice management, sterilization assistants. And these are all, and also there is a dental assistant association called the American Dental Assistant Association. So in 1947, a 104-hour course was developed to give credentials to assistants who pass the written and clinical exams. If the dental assistant passes the exams, they can then have the title of certified dental assistant, which is a CDA. And some states require the certification in order to perform expanded functions. Juliet Southard was the founder and the first president of the American Dental Assistant Association. So the American Dental Assistant Association was founded on 4 principles, which involved education, efficiency, service, and loyalty. Dr. Alfred Civillon Fonez developed the first school of dental hygiene in 1913. Irene Morgan was the first dental assistant to be trained in dental hygiene. She was trained by Dr. Fonez. Duties performed by a dental hygienist include removal of plaque, stains, and calculus from the teeth, along with patient education. So now dealing with dental laboratory technicians, these are people who have graduated or may have graduated from a 2-year ADA accredited dental laboratory technician program. Although formal education is not required, and many times these laboratory technicians have no formal educational training, and they receive a lot of their training on the job. Dental laboratory technicians may work in the office or in a privately owned dental laboratory. Dr. William H. Stowe, which was a dentist, and Frank E. Eddy, which was a toolmaker, were the first to open a commercial dental laboratory in Boston in 1883. The commercial dental laboratories provided such services as fabricating gold and porcelain restorations and partials to full dentures. Dental laboratory technicians do have a type of certification. There is an examination to become a certified dental technician or a CDT or an American dental laboratory technician. And to do that, you would be accredited by the ADLTA, which is the American Dental Laboratory Technician Association. Other members of the dental team include dental service technicians. These are people who go and fix things such as dental chairs, autoclaves, ultrasonic cleaners, and things that can malfunction in the office. Dental representatives may come in, as you may know them as salesmen. They will often try to not only sell things, but to give the doctors and everybody on the dental team a little bit of insight into new products that may help make their jobs easier. Dental supply companies and representatives sort of do the same thing. They will come out and approach the doctors and the dental team whenever there is a new product available or whenever there is something new to the industry that hasn't been seen before. All right, so the creed for dental assistants includes this very profound statement, which is to walk on the sunny side of the street, seeing the beautiful things in life rather than fearing the shadows. So this is one of the quotes or sayings inside the creed for dental assistants. All right, so this is everything I have for chapter 1. Please let me know if you have any questions. Thanks for listening.